Hey everyone, and welcome back to the live stream. If you are here with me live, drop in a comment and let me know where you are tuning in from today. Where are you watching from? And if you are catching this on the replay at a later date, say hey with a hashtag replay so I can show some love to my replay crew. Today we're going to be talking about medical coding career stuff, Q&A primarily as usual. And we're going to be talking about where you are in your career right now, in your coding journey. We had a lot of people that probably started around January. Now we're maybe getting into some CPT stuff or some maybe just still doing ICD-10 CM. We're just starting into March. Oh my gosh, it's, 2 months of 2026 already down. But yeah, let's talk about coding jobs. I have some reports that run so I can kind of keep a little pulse on what's going on without having to be too far into the weeds of some of these Facebook groups, some of these Reddit posts, because they get a little wild, right? My gosh, a lot going on, a lot of commentary, a lot of opinionated people. But yeah, so today we're going to be covering things like what should you be focusing on in your studies, like what certifications do you need, what content do you need from me, and barriers and all that kind of stuff. Live Q&A throughout, so definitely drop your questions as we are going through. If you're new here, hey, I am Victoria. I'm a medical coder, auditor, educator, content creator, and on my channel I provide tips, tricks, and tutorials to help you be successful in a medical coding career. Today's live stream is sponsored by Preppy. If you are looking for affordable medical coding training, you can head over to startmedicalcoding.com and find out more about the program that I recommend, which is Preppy. But without further ado, let's get started with today's live stream. Dun, 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 dun. StreamYard. Ah, StreamYard is the platform that I utilize to do the live streams on multiple platforms. Been using it for years. Have met with Team StreamYard. Great platform if you are looking at doing multiple streaming yourself. I do have some, um, I think, links in the description if you need to save some cash on a subscription to StreamYard. I can't imagine how many of you that's going to apply to. All right. So if you are new here, I'm going to be here talking about medical coding, talking about what's going on in the industry, answering Q&A. We are live streaming on multiple platforms. We have, through StreamYard, we're bringing in Facebook, LinkedIn, YouTube, Instagram. I'm bringing on TikTok through my mobile phone on a different platform. So I'm sorry, you guys don't always get the screen shares, or we get a little bit of a delay as we're handling the screen shares. But yeah, I'm excited to take on some questions today. I've been trying to do some more stuff with talking about AI because I know it's a hot topic for people, but it's really hard. Yeah, there's just a lot of opinions out there, and I don't know that necessarily me saying like AI is not going to come for your job is going to cool any people who are terrified that it's, coming for everyone. But yeah, I do what I can. Coming in from Instagram. I'm an 18-year-old kid from New Delhi. My qualifications are that I just passed 10+2, want to be a medical coder, and I want to do business in this field. How can I do that? What kind of business? So if you're outside of the US, I would definitely check into certifications that are available in your country. The focus for a lot of people who are outside of the country and want to learn medical coding oftentimes is, hey, I want to learn medical coding and work for companies that are in the US. I want you to understand that when you're looking at career information, because you're become interested in becoming a coder, that coders outside of the US don't make what coders who are located inside the United States make. Oftentimes, if they offshore medical coding to places like India or Pakistan or the Philippines, it's because they're looking at a cost savings. They want to do that because they don't have to pay the employees there as much. So when you're looking at salaries, consider that, and just look at what institutions you have near you where you can train. There is an AAPC Global, so you can go to the AAPC Global website and probably find some more information that would pertain to those that are located outside of the United States. Mantopia says, are the guidelines in CPT 2025 and CPT 2026 still the same? They are probably 98% the same. There might have been some code changes where the guidelines were fine-tuned a little bit, but I wouldn't say that, like, if you have a 2025 book, that it's gonna be wildly, drastically different versus 2026. So it's majority gonna be same. They're not gonna rewrite coding guidelines from year to year. They're just gonna tweak things that maybe they didn't explain correctly in the prior years, or they wanted to clarify, or some codes changed, and now the way that we select the codes for that particular section may have changed. But as far as, like, if we're looking at all of the surgical guidelines, for example, are wholly the same. You don't do a lot on CPMA. Why? No particular reason. I used to have a CPMA review class, but I no longer have my license with the AAPC because it just wasn't cost effective for me anymore. I do have some videos on the CPMA. I have plans to do CPMA videos. It's just there's a lot more interest and focus on the CPC, so I focus a lot of my attention there. I do talk about CPMA when I talk about, like, other credentials. I think I have another video coming out soon. Just sent it to my editor that's on what certifications to get after the CPC in 2026, and I do talk about the CPMA in that one. I do not provide a lot of study materials at this point for the CPMA. I have some other stuff I'm working on, but I do have on my content list, because I can only do so much at once. I'm a one-person business. Um, but I do have on my list to start doing some things like missed concepts for different certification exams or reviews for certain certification exams, like mini ones. Sorry, I'm a Scorpio on TikTok says, what cert should I get after the CBCS? CBCS. So CBCS is not accepted for coding positions by most employers, right? There's only little pockets of areas where they might take it for coding positions. If you're just looking to get into billing or in revenue cycle, a CBCS is fine. But if you're looking to get into a medical coding position, I would highly, highly suggest getting your CPC, or if you want to get certified with a HEMA, either the CCS or the CCSP. Those would be what I would recommend. That's what employers are looking for. Although I have heard some people say that they've looked in their region and they found that more people there are looking for a HEMA credentials, so they might be looking for a CCS. If you're someone who was trained, though, in more of a CBCS kind of arena where you do more pro-fee coding and billing, that's going to be a whole different learning curve. If you're going from professional fee coding involves CPT, ICD-10-CM, and HCPCS. When we transition into inpatient coding roles, coding for facilities, we have to learn ICD-10 PCS. That is a whole other ballgame. It is not even comparable to ICD-10-CM. It is a completely different code system that you would have to learn. It's not like CPT and HCPCS where it's like, oh, if you know CPT, you can kind of figure out HCPCS. It's very intuitive. Whole different arena. So if you're looking to get from pro-fee coding to inpatient coding, whether it be through the CCS or the CIC, you're going to need some additional training. When I decided to learn inpatient coding and go for my CIC, I believe I got some training through the AAPC. I think I went through their CIC program there. A lot of that's going to cross over to CCS territory, but the CCS exam through a HEMA is structured very differently. Does the AAPC offer internship to get rid of apprenticeship status where Preppy does not? So the difference, let's first talk about the apprenticeship status and how to get rid of the apprenticeship status. So traditionally, the way that you can get rid of the apprenticeship status, and let me even back up a little bit more for those who are newer. When you become a certified professional coder and you take the CPC exam, if you do not have 2 years experience or the equivalent, you are automatically designated a CPCA. There's no difference in the examination you take. There's not a CPC exam and a CPCA exam. It's all the same examination. It's just that without that experience, you are automatically designated an apprentice coder. The old school traditional way of removing that apprenticeship status is getting 2 years of experience. There are things now that will each take off 1 year off of that 2 year experience. The first is that if you have 80 contact hours of approved medical coding training, that will take off 1 year. So that could be a transcript from your school, that could be a certificate from an approved instructor saying that you had at least that 80 contact hours of medical coding education. That can be submitted to the AAPC for 1 year of removal. The other thing is Practicode. Practicode can remove 1 year off as well. And those are like mock modules. It's a set of hundreds of notes that you buy from the AEPC, and you have to code them from scratch. No multiple choice. It is very difficult. So that can also remove a year off. So when we talk about the 80 contact hours and the Practicode, neither of those are apprentice statuses. No, neither of those are internships or externships. So an externship counts as experience. It doesn't count as the 80 contact hours. It doesn't count as Practicode. So when we're talking about an internship or externship, that just counts towards your coding experience. So the 2 years of coding experience. So if you have an externship or an internship through AAPC or Preppy or your tech school or whatever, that is just going to count towards your total time for your apprenticeship status removal. So you would have to work at that internship. If you didn't do Practicode or the 80 contact hours, you would have to work through there for 2 years in order for it to remove your apprenticeship status. Or you could work there for a year and have the 80 contact hours, or work there for a year and do Practicode. So APC and Preppy and a lot of the other programs out there do count towards the 80 contact hours that can help remove that 1 year off of the apprenticeship status. That is one of the caveats to self-study. Did I bring my self-study book? I got the new step-by-step medical coding book recently to do an updated video on, hey, if you buy this book to self-study, like this is how you go through the process. But yeah, if you self-study, which some people swear by, they're like, I had no problem self-studying. It was great. If you do that, you can't use that towards that 80 contact hours of formal medical coding education. So that is one of the setbacks of self-study, is it might take longer than for you to remove that apprenticeship status, because then you have to wait to actually get some experience. Because even if you do Practicode, you still have to get a year of experience to fulfill the 2-year requirement. Cheryl's asking, is the CMRS certification wanted, or should I go back for something else? I'm not familiar with the CMRS certification. I know there's a new Rev Cycle one that the AAPC has, and I'm not quite sure as far as what that would be for. I don't know if that's the CRMS, though. I think that's I'm not really sure. Can you tell repeated compliance and regulatory questions from 2026 CPC exam point of view? That's not something I can do on live, but if you're looking for some questions that are similar to those that might be on the CPC exam in 2026, I can put that on my list of topics for the future. Bree Miller says, companies seem to be moving to offshore coders. Do you think coding will change in the coming years? So here's what I want to say about the offshoring of medical records. I have been in medical billing and coding for over 15 years. This goes through cycles constantly, just constant cycles. And I foresee this happening with some AI as well. So what typically happens is we'll have an organization that's like, hey, you know what? We found this company in another country that we can pay these coders here a lot less, and we're going to save a ton of money because they'll just code all our stuff and we won't have to worry about it. They said they're going to take care of things. And what happens is they send all this stuff offshore and they do it for a little while. And then it's a back and forth between them and coding managers. Or, hey, we have this audit. Well, they don't know how to handle the audits, or accuracy rates drop, or there's more difficulties, or things are getting hit by into falling into queues that no one knew about. And they're like, wow, this is a lot more of a process. And we're doing all this back and forth and it's just costing as much, or we're losing money because we're getting audited and things aren't correct. Let's just bring it back in house. So then they bring it back in house. Well, then the next company decides that they're going to try and offshore people. And I think we're going to see that too with AI. We are absolutely going to see some companies that are like, you know what? This guy from the vendor said that we can just eliminate all of our coders and have the AI code it, and it's going to be wonderful. And they're going to do it. And then it's, a few months might go by and denials will start bouncing back, or they'll start getting audits from Highmark or from Medicare or Medicaid and realize that maybe things weren't done as well as maybe they should have been. And then they're going to go, oh, let's bring back the coders. So we see a lot of cycles of this happening on and off, and have for years and years and years. When electronic medical records came into play, and I talk about this with other coders that I've interviewed on the channel, these vendors came in and they're like, you don't need these coders, the electronic medical record systems, they're just going to automate all the coding and it's going to do everything for you. You're just going to click a button. And that's some people absolutely did attempt it, and they're like, hey, let's get rid of all our coders. And then after a little while found out maybe it wasn't the best idea, and changed course. Val says, most jobs want 2 years experience. How can I get a job? So there's a couple of places that I would recommend looking for medical coding jobs. I recently talked about the externship program, and I will share screen of that. So the AEPC does have an externship program. They are very, very limited. Right now, I think there's only two. One of them is down to only applicants in Florida. You can find them at jobs.aepc.com. Jobs.aepc.com is also a great place to go just to find medical coding jobs or jobs within the revenue cycle. What I like to recommend is when you are searching for jobs, if you're on a site like this, or, well, this is all going to be a lot of everything like coding adjacent, but if let's say you're on Indeed or Google Jobs or LinkedIn, type in ICD-10. Because all types of medical coding jobs use ICD-10. So now we're not just limiting ourselves to jobs that are medical coder or medical coding titles. We're looking at jobs that maybe they want someone who has that skill set. They want someone who knows ICD-10 CM, whether you're certified or not. And that means we can get our foot in the door. We can find something that's coding adjacent, where we're involved in medical coding. We're working on our medical coding skills. And that gives us an opportunity to maybe transition into a coding role or transition to a different type of coding role. So those are some of the tips I have. If you have a program that offers externships and you have that capability, take it. You can also do things like making sure that your resume is up to date. There's a lot of local chapters that offer career support, that they offer sessions where they're like, hey, you can come in and you can have us take a look at your resume, or you can talk to people who maybe are working at different organizations and know when positions are gonna open up. So get in and start networking. If you need your resume done, there's a couple of places that I recommend. Let's see if I have one here. Project Resume. So you can get your resume done over at projectresume.net. If you use code Victoria10, you can save a little bit at checkout. I have had, because I did hire like a coding intern recently, and sometimes people just send me their resume. They're just like, here's your resume, hiring manager. And I'm like, I'm not hiring anyone, sorry. But I do look at them, and there's oftentimes where I will look, at people's resume. And within a couple seconds, I'm like, wow, there's some pretty glaring errors out here. Sometimes I look at them and I'm like, I can't even tell if the person's certified yet. I can see that maybe they had some schooling, that they did training maybe with the AEPC, but I'm like, where's their member ID number so I can validate if they have their CPC or if they're still planning on taking the test? Like, where are they in that process? Even little things like if you spell something wrong or something's not formatted right. I had one person send me their resume that instead of actually sending me like the PDF that you could like search, they had their resume on a printed piece of paper. and they took a photo of it with their phone and sent me the photo of the paper of their resume. So, if you've not had some career support in the past, you might not realize that that's not an appropriate thing to do, especially if you're really looking for a job where you have to have office skills. I wouldn't want to hire someone who wouldn't know how to have a typed, properly formatted resume, because then it's going to show to me that, if I put them in an office setting, they might struggle. They might not know how to format a Word document or save a Word document as a PDF, like some of those basic kind of office functions. So those are some of the things that I recommend as far as looking for a medical coding job. Let me get my banner off of here. But although while I'm speaking of banners, before I forget, if you are new in your medical billing and coding career and are looking for a place to get trained, today's live stream is sponsored by Preppy. So if you're looking for affordable, on-demand medical coding training that's going to work with you, it's going to work with your budget, check out Preppy. You can find out more at preppy.org. And you can find out all about Preppy and the program that I recommend and all of their career support that they include with their program. Very budget friendly, includes the materials that you need in ebook format. And yeah, gotten lots of great feedback from my viewers. They take amazing, amazing care of all of the viewers that I send their way. Hey, Tiffany, good to see you in here. As a medical coder, are you also the one that has to speak to or argue with the insurance company? Typically not. Most medical coders, well, actually, when I was over at Lancaster, they were trying to cross over some things. And what we found out was that a lot of the medical coders aren't really trained in the appropriate customer service voices and how to engage with customers. So it was much better for the people who were trained in customer service and trained in patient relationships to have those conversations with the patient. There's also teams of people that are better trained to deal with the insurance companies. Now, there are instances, depending on what your role is in coding, where there might be denials from the insurance company that they're like, hey, Highmark denied this. They're saying it's not coded correctly. They'll kick it back to the coder, and the coder might look at it and go, nope, this was actually coded correctly. Or it might be, sometimes, unfortunately, we find that, the insurance company is only going to cover a procedure if the patient has certain diagnoses. And we coded it correctly, but that patient just didn't have that qualifying diagnosis for the insurance to cover it, which sucks. And we all don't agree with. Like, obviously, we would love everyone to get all of their things covered by the insurance company, but we can't add on a diagnosis code that's not justified, that isn't in that patient's medical record, that they haven't been diagnosed with. So we do see that sometimes in medical coding, where, we're working with other people within the revenue cycle, but not necessarily it's the coder calling the insurance company or it's the coder calling the patient. Christy asks, hi, do you have a video on how to use the ebooks for the CPC exam? I'm actually doing an updated one. I think it's on the content calendar for later this month. Let me actually take a look, because I do have some currently, but they're from a couple years ago. And some of the things that were limited in the ebooks a couple years ago, we can now access. And some of the things that we could do a couple years ago, now we can't do. For example, there were no links in the table of neoplasms in the ICD-10-CM book for AAPC. So when you would click on the table of neoplasms, like, there weren't links to take you to the codes. Now there are, but they also eliminated some of the capabilities to copy and paste text because of them wanting to protect the text in their, I think, workbooks and different things. So I think you can't copy paste from the book, but there's more links and ability to navigate now. So I have to do an updated one. Let's see what's on the schedule. I have I have a lot of stuff coming up on the schedule, but not that conference next week because I canceled that. Yeah, so I'm doing it up. I have an ebook tutorial planned for 19th of March. I'm also doing a couple of things. What else have I got coming up this week? This week, my gosh. I think next certifications after the CPC ebook tutorial, and then I'm working on the most missed concept for the CRC exam. So you know how I have that very popular video that's like, here's the concepts that get covered a lot that people miss in the CPC exam. I'm going to try to start doing that for other certifications. It's a little harder because I don't think the AEPC offers that specific data, especially to like teachers or students or anyone in general. But just from conversations I've had with people regarding what they've struggled with, things that they've said, like, I think I didn't understand this concept on the exam, or things that I know are harped on a lot for the exams, I think we can kind of piece that together. Let me just fix my scene real quick because I can't. Whoop, nope, that's not what I want to do. Let's move this. Hold on. I'm going to minimize and open back up. Darn. Okay. Hold on one sec. My screen just started looking really funny. Maybe if I do that. Nope. Nope. Oh, I know. There we go. Now I got it. Now it doesn't look weird. And I can see all the comments correctly. Yeah, March 19th is when I'm going to do the new updated ebook tutorial video. The videos go live on YouTube every Thursday at 11 a.m. I've actually been doing a ton of additional content lately, which you guys probably have noticed. So in addition to the long form videos every Thursday, sometimes I'll put out 1 or 2 extra, only because I hate to have everything be a promotion for my sponsors. So I like to fluff it up with additional content. And then I have a lot of just shorts videos coming up. The Let's Code It videos, those are coming out. I think I have those scheduled every Tuesday through the rest of March. I have some clips. Oh yeah, I have Let's Code It's every Tuesday and Fridays, it looks like, throughout March. So yeah, a lot of stuff coming out. But if you have video recommendations that you're like, hey, Victoria, can you go over this particular concept? Definitely let me know. Sometimes the ones that are like super nitty gritty, they help out so many people, but they don't get as many views. So it's a balancing act sometimes, right? Bab says, would you recommend book or ebook for the CPC test? It really depends on your learning style. Some people, they're like, I really like to have my paper book, because paper book, we can put tabs in. Paper book, we can feel, we can touch, we can highlight, we can have notes in here. An ebook, we can't have tabs, we can't have notes. They give you kind of a blank shared ebook, but ebook, you can search faster, right? So it depends on what you might weigh a little higher. Do you more so want the ability to notate your books and have tabs and highlights? Or do you more so want the ability to use the search functions in the ebooks and be able to find things and navigate a little bit faster? One thing I will also mention, though, as a caveat to the ebooks and the search is it's the magnifying glass. Like, you have to click the magnifying glass and type in the words, because with the CPC exam, they have disabled right click. They have also disabled the alt key. So you can't do like an alt F, or is it not an alt F, control F, and find something in a body of text. You're not able to search that way. It's more so just manually clicking the magnifying glass, typing in, for example, hypertension, and then searching for that term within the book. You can't do a control F and scan that body of text and find that small piece of text. You also can't do it in the, oh, just lost my train of thought. Oh, in the exam itself. So let's say you've got like a 2-page note that you're coding and you want to search for a certain word in that note. You can't hit the control F or do any searches within that note that you're reading to code. Pecorino Romana says, I took my test Friday and used so many of your videos to help. I passed with an 86% and I did the course and the exam in 8 weeks. Holy cow, 8 weeks. Thank you for sharing your knowledge. That's awesome. It's fascinating to see sometimes how some people can get it done so fast and others, they want the more like 9 to 12 months, and some people are just yeah, I mean, all walks of life. Some people might have better backgrounds in med term or might have some clinical experience and can skip a lot of that stuff and get it done faster, but I think a lot of people it takes around that kind of like 6 to 9 month sweet spot. But yeah, 8 weeks is amazing. Congrats to you. Congrats on your CPC. Now it's time to start earning CEUs, which reminds me, um, I have been posting this over my Facebook and my LinkedIn and stuff, but I wanted to share it here too. And I recently got a partnership with Billing Coding Advantage magazine. Now, I've subscribed to Billing Coding Advantage magazine for years and years and years. It's a bi-monthly magazine. They send you the print version. You can get the digital version online as well. So if you lost your print version or whatever, or they ran out for that month, you can go online and access it. One of the cool things, though, is when you subscribe to Billing Coding Advantage magazine, which I worked at a really good deal that you guys can subscribe for $79. TikTok, check in my link in bio or on my website for the link. But Billing Coding Advantage magazine, so you subscribe, it's $79 a year. They include a big, big bank of webinars, like 30 plus webinars, and they each can be completed with the quiz to earn CEUs. So we're talking 30 plus CEUs in a year for $79, and they are good for AAPC and a HEMA. So if you have an HEMA credential and you're struggling right now to find cheap CEUs, Billing Coding Advantage magazine, like you'll have a stockpile of them. It'll be great. Like I've had a lot of feedback from people that are like, oh yeah, like this is how I get all of my CEUs for a HEMA. I pay the $79 and I don't have to worry about it. So, and there's always, though, free and cheap ways to earn CEUs. I did have someone complain. I thought this was the funniest thing. You know how I do an updated video every year, like here's how to find free and cheap CEUs for AEPC? I guess someone came in and thought that they would earn CEUs by watching the video and were like yelling at me and saying like, well, all you're doing is just trying to like scam people or something. And I'm like, I'm literally just telling you to like read the AEPC magazine and go on the Medicare website and you can get free CEUs there. I don't know what you thought this video was going to be when you clicked on it, but I have lived up to the delivery of here's how to find free and cheap CEUs. I'm very confused. Some people are so angry at the most random things. TikTok user says, I just passed on February 28th. It says I need to submit 3 CEUs by April 30th. Are you by any chance on a corporate membership? Because what sometimes happens is when you are part of an organization that has a corporate membership, so let's say I'm working for XYZ Hospital and we have in our department 10 coders. I will buy a cheaper subscription of corporate memberships for 10 different seats. So if one person comes into one of those 10 seats or leaves it, they might have their CEUs prorated and that date might change a little bit. And I think there's other times they might change it for certain other things. I'm not aware of all the different scenarios, but I know that's one where they primarily can shift it. So you might find out that your prorated CEUs and now you don't have your CEUs due for a little over 2 years, or maybe they're going to be due in 2 months, when you have instead of 36 CEUs, maybe you have 25 due and they're at a sooner date or what have you. But yeah, there's lots of free and cheap ways to earn CEUs. AAPC magazine, you can find this on the AAPC website. You can subscribe to the print version and you automatically get the digital version. It is on the AAPC website. I can show you guys that for those of you that are not on TikTok. If you log into your AAPC website, you can access it. Oh, there we go. Under the resources, and then it's AAPC the magazine. Under AAPC the magazine, there is a quiz called Test Yourself, and you can access all of the quizzes there. You can also access the archive of past issues. But when you complete that Test Yourself, which is based off of some of the content in the magazine, and you pass that Test Yourself, you get 1 CEU. So that's a really easy way to get 12 CEUs every year for free. Well, I shouldn't say free, included in your AAPC membership. There's also usually 4 webinars that they include, and let's see if I can find where those are. Let's see. Certifications, maintain your credential. And then I know it's around here somewhere. Low cost CEUs. And then we go to, oh, that wants me to sign in. One sec. I need you all to see my sign in info. Sign in. There we go. It's loading. So once we go to the website and then we go to that low cost CEUs, it'll take us here, and here are the members only webinars. Now, again, where we went was we went to certifications, maintain your certifications, and then on the left-hand side, we went to low cost CEUs, and that's where we find the members only webinars. So they have 4 CEUs that you get as an AAPC member that are each worth 1 CEU. And they talk about the Test Yourself and then also local chapters. So you can find out even more here about your local chapter. I think they've moved some things around recently where it's not as easily identifiable what your local chapter is. But yeah, that's how you can find out some stuff there. They talk about the CMS web-based trainings. I get a lot of mine through my local Medicare contractor, Novitas. They've actually had some pretty decent stuff. They've actually gotten full, I think, recently of some of their training sessions, which is great. This is, sorry, my eyes are not that good these days. Creative Gmarts. Do you know anything about the CCS? So I'm not an AAPC member, no hate to a HEMA. It's just, yeah, it's not been a big goal of mine to get certified with the HEMA. I like kind of keeping everything within the AAPC, so I only have to worry about the one membership and the one set of CEUs due. So I've not looked too much into the CCS, and I unfortunately can't advise a lot about CCS or a lot of the HEMA credentials. Show Me the Way says, "Hi, I'm in the preppy program, which I love, and I have a shot at a non-cert coding jobs. Any tips for the interview?" Okay. So tips for an interview for, I would say let them know that you're planning on getting certified. Be careful about not making it seem like you immediately want to transfer into a different position, like you're going to go to another department. Let's see. I would say a lot of times they like to ask about what you've been doing to stay up to date. Think about your, like, tell me about yourself. Like, what are some of the things that you want to talk about and mention about yourself that aren't going to be like super personal things? Um, yeah. Other than that, if you're doing an online interview, make sure that you're wearing appropriate attire, that you don't have anything weird in your background, that you're not like, I mean, there have been, unfortunately, people that are, like, walking and talking on their phone during job interviews and stuff. Um, and a HEMA membership is not a requirement. Yeah, so if you wanna get a credential with a HEMA, my understanding is, yeah, you don't have to be a member of a HEMA in order to get those credentials. But either way, I'm not a member and I don't have their credentials. I have a micro credential through a HEMA. I have the risk adjustment coder micro credential, which that has been quite the journey between getting that credential and then it's, hey, you need to recertify after a year. Oh no, just kidding. It's going to be 2 years. Oh, just kidding. It's going to be the end of this year. Actually, it's going to be the end of next year because we're still figuring things out. So that experience alone has kind of put a bad taste in my mouth with getting further stuff with the HEMA. Sequence changes, Bucks 2025 workbook answer didn't line up with the 2026 ICD-10 sequence guidelines. That I don't know about, Michelle. I'm really sorry. I have not compared. I only have the 2023 paper Bucks books and the 2026. I might have the 2025 an ebook. But yeah, I haven't done a compare and contrast of those. I know there were some ICD-10 CM guideline changes from 2025 to 2026, which I do have a video on. If you go to the YouTube channel, I have the 2026 ICD-10 CM, 2026 ICD-10 CM updates where I talk about what has changed from 2025 to 2026. So you're saying AAPC is better, it's more expensive though. Aren't usually better things more expensive? Well, you get a lot more for your membership though with the AAPC. Because like I just talked about, like you get AAPC the magazine, you get the members only webinars. Sometimes they just throw you free stuff. Like a couple of years ago, they're like, here's an AI and medical coding course. There's a lot more chapters, there's a lot more networking capabilities. You get a lot more included with your AAPC membership. You get discounts. There's an AAPC discount program. You get discounted insurance if you're someone who wants to go independent and you need insurance as a coder. So there's a lot that you get included in your membership. I've always found it extremely worthwhile. By the way, speaking of AAPC, I will be at HealthCon this year, you guys. Attending in May, going to be making a lot of content while I'm there. If you are going to be at HealthCon and you want to collaborate on anything, want to provide an opinion or help me make some videos, definitely hit me out and let me know. I'm going to be there. I'm going to be talking to people, interviewing people, talking to the vendors. I don't know if I want to set up something where we maybe like grab a dinner or have a Q&A. I don't know. I feel like maybe I should tap the NamUs booth or something and be like, hey, I'm going to come hang with you guys just so that I can tell everyone if they want to meet Victoria from Contempo Coding, I'm going to be over at the NamUs booth. Daisy says, oh, I'm sorry. That's not the one I wanted to pick. CPC is just inpatient coding, correct? No, CPC is certified professional coder. So that's a different type of coding than inpatient coding. Inpatient coding would be your CIC or the CCS. So that would involve ICD-10 PCS coding, which isn't covered in the CPC. Daisy says, I live in New Jersey. There's a lot of medical coding jobs, but that one experience. Yeah. Okay. Ellie says, hi, I passed my CPC in January, struggling to find a job with no experience though. Yeah. So my recommendation would be to look for coding adjacent jobs where you can use your medical coding skills, but maybe not necessarily the title is medical coder or medical coding specialist. If we even look at some of the jobs that we find on the AAPC job board at jobs.aapc.com, we can find right there, right now, they have 6,410 jobs. Now, the filters on these aren't always the best because I think when people post them, they don't set the appropriate filters. But when we look at the jobs.aapc.com, we might be able to find some things that are more coding adjacent, or we can refine by credential. I thought they used to have one that was people that would take the CPCA. Other. Let's see what's in other. So if we go into other, we have some things that are coding adjacent. Experienced biller, accounts receivable, medical social worker supervisor, program supervisor. Ooh, look at this. Virtual coder hiring event, remote eligible, Memorial Regional Hospital in Florida. Profi clinical data quality admin. But yeah, I would recommend if going into Indeed.com, going into Google Jobs, LinkedIn, anywhere you're researching for jobs, and type in ICD-10 and look for those jobs that maybe aren't necessarily titled medical coder, so you can start working on your coding skills in a coding adjacent job. MD Weaver says, I am looking for a program. Can you help? Yes. If you go to the link in my bio, you will find a link that says my medical coding training recommendation, and it will take you to Preppy. The new link that I use for Preppy, just because it makes it a little easier instead of saying to go to the masterclass, you don't have to sign up for the masterclass anymore if you don't want to. You can go to startmedicalcoding.com. So startmedicalcoding.com, and that'll give you all of my recommendations about the program that I recommend Preppy. Do you recommend prep test websites other than AAPC? Not really. The reason I say that, it's not because I'm trying to be like, oh, no one else does it good, or they're not training correctly. It's that there's a lot of AI slop now. There's a lot of scammy websites out there that went on SlideShare and stole some old quizzes from 2015, or they created some crap in Claude or ChatGPT, and they're just selling it to make a quick buck. You can't even contact them then to find out who you would ask questions of or demand a refund. So there's just so much scammy stuff out there right now. It's really hard to say what is good and what's not. The things that I absolutely can recommend are the official stuff from the AAPC or the Bucks step-by-step medical coding training books. I think they're really good for learning medical coding and then practicing and all of the prep that comes with that too. Yeah, I'm trying to think. I mean, I've done some training in the past with CCO.us, so I know they're good. They used to have a free, like, 20 question or 50 question or something practice exam, but I think now they charge like $5 for it because it was too much of an admin thing. Their Blitz programs are really good. I'm not too familiar with all the different programs out there with like Coding Clarified and Jen and Tiffany and all of them. Nothing against them. I don't I focus on my stuff, so I genuinely have no feel of like what everyone else is doing. Because if I start looking at all of the other influencers and companies out there and what prep they are making, I start comparing it to me, and then you go down this like spiraling rabbit hole, and it's not good. But yeah, those I will definitely recommend is the Buck step-by-step stuff and the official stuff from the AAPC. I'm working on putting together some of my own stuff. It's just it's slow. It's slow. And then I try to get people to help, but I'm like, oh, it's still a lot. It's still a lot. Hi, Victoria. I'm a new CPCA. Thank you. Your videos helped me so much. I was just looking around the AAPC website and saw you on the cover of the AAPC magazine with your cute pink hair. Yeah, thank you. It meant a lot to me, and I think it meant a lot to other people that when I presented myself on the magazine, I wanted to kind of nudge AAPC. They've been a little bit traditional in the past, and they're starting to come over a little bit more now. So I really wanted to have that representation to people to say, I when I started out even in medical coding, one of my goals was like, wouldn't it be cool if I got to a point in my career where I was recognized at such an expert level and was so notable in what I did that I could show up and do a presentation at like HealthCon with purple hair, and people wouldn't care because they're like, we just want to hear Victoria because she's amazing, and we don't care about the purple hair and stuff. So it meant a lot to me to kind of be able to show up on the magazine with different colored hair, especially in light of some people still holding on to some of those outdated standards of like, you shouldn't have tattoos or you shouldn't have colored hair because it's unprofessional. Like, no, let's let our expertise and our character speak, and not the tattoo, hair color, piercing stuff that people want to focus on. When did you start your medical coding career? I'm trying not to be overwhelmed by overwhelming starting over. Yeah. So I started out a little bit about my kind of journey. I started out, oh my gosh, it's been a little over 15 years. I originally, after high school, went to college. I went to Reading Community College for web design. Had some mental health issues. Um, Wanted to focus on getting those straightened out, did. And then I'm like, what do I want to do as far as a career? I don't know that I really want to do web design anymore. I didn't really like the programming aspects of it. And it just didn't seem like something I wanted to enjoy beyond just hobby. So I'm like, my mom had kind of recommended that I get back into school for medical billing and coding. And I was at that area where I'm like, maybe my mom's not so stupid. Like, I'll go listen to her. Went back to Reading Community College and enrolled in their degree program. Well, not degree, not like associate's degree, but diploma program, we'll say certificate program, their career training program for a medical insurance specialist. Wound up getting a state grant. So the state covered that training through them. And got a job doing charge entry at my local hospital. I was then hired from I did an internship, was hired off the internship, went from Reading to Lehigh to Lancaster, taught at Berks Tech in the evening, was at Penn State Health for a while. But yeah, that's kind of how I got started. Back then we didn't really have the online training. So if I was starting today, I probably would not have bothered driving myself into the inner city of Reading to have to go and get education. I would have stayed home online and done it with a program like Preppy. But yeah, that's how I got my start. I've been in the industry for a while now, and always strive to put myself in the shoes of the people just starting out. When you've been in medical coding for so long, we see some people that do get very jaded and they want to talk down to the newbies or say like, oh, well, back in my day, my exam was 5 hours and 40 minutes and you guys, I can't do that. I can't do that. It's just, I want things to be better for the up and coming coders. I want them to find jobs easier. I want them to understand the industry better. I want them to have a better time understanding their benefits as members. Like, why would I want to punch down on the upcoming coders? Like, forget that, right? Daisy says, does Preppy give you books to study with? Everything that you get is in ebook format. Later on, when you're sitting for your certification exam, if you want some of the paper books, they can do that, but everything's given in ebook format. So you get the ebook versions of the Bucks books as well as the ebook code books. Run with British says no one needs gatekeepers. Yeah, there's a lot of things I do gatekeep about. Not about like good medical coding practices and stuff, but like I'll gatekeep from other people in my industry, like how I do run my business or how I'm so good at like social media and stuff, but like not like here's how we can find free and cheap CEUs or here's how we can code cases more accurately. Class says I can't find the Preppy link. It's startmedicalcoding.com. So startmedicalcoding.com. You can find it. It's on my bio. It says medical coding training recommendation or something like that. I think I just updated my link tree. So my link tree is all updated. The link in bio link tree. Yeah, so excited for that. Jobs, yeah, and then I'm going to HealthCon. I'm trying to get in on one of these panels. Like I keep knocking on, like, hey, those panels. Like, can I come hang out on one of those, like, and talk and give my opinions? Haven't heard anything back yet. I know some of y'all are watching. I know they watch me because there's been times where I've made TikToks about not getting certificates for like months and months and months, and then they show up like next week on my door. So speaking of books, where do you purchase the book spiral protector so they don't unravel? There's a couple of different things you can do. I don't know if people necessarily buy spiral protectors. I've known some people that take like a tiny rubber band and they tie them that way. I don't know exactly how they do it, but I've heard of people doing that. And some people actually just get a little piece of tape or just tape it around. And I've also heard hot glue. That reminds me, I want to do a video about hot glue. You can also just hot glue the ends of the spiral. So what you would do is you would take the end of the spiral here and just hot glue it to the end there, and then it won't unravel. So if you just hot glue those together or tape them together, But as far as like where would you buy a book that I'm not sure about spiral protectors. Maybe Staples. Maybe Staples baddies knows where you can get some of this. Cheers to Staples baddie. Anyway. Daisy says, I want to sign up for Preppy. I hope I'm picking the right program. I know that they give you an Auburn University certificate, not certification. Certification, you still have to sit for the CPC certification, regardless of what program you go through, whether it's AAPC or Coding Clarified or Integrity Coding or CCO or whoever else is out there. You still have to sit for that proctored examination and pass that in order to become a certified coder. So kind of a differentiation there. But yeah, there's lots of other programs out there. Like I said, I went years ago to my local community college and was able to get a state grant. So you might have somewhere in your area where you can get a career improvement grant that might cover your schooling. You might have a spouse that works somewhere where they say, hey, if you go to this tech school or this particular college, we'll reimburse for it. I know there's certain programs through the military where you might be able to get education in medical billing and coding. A lot of the programs either use the AAPC curriculum or the step-by-step curriculum. Those are the top two. You have some stuff out there like Ed2Go, which I've heard mixed reviews on. I've had some people say, yeah, I used Ed2Go, wasn't that bad. And I've heard a lot of people say I used Ed2Go and it was, Sometimes the program depends on what you're willing to put into it. Some people, they want a program that's going to be all the bells and whistles and everything. Sometimes it's not that. Sometimes it's bare bones and you have to do some additional research. And it is what it is. Crystal says, I'm studying for my CPC that her hospital had a meeting that doesn't plan to hire any in-house coder, and another friend that said her company is sending med coding to India. Help. If you go to the beginning of this video, I kind of discuss a lot of that there as far as the cycles of offshoring as well as sending coders, coding positions offshore and then back on, and AI and all of that. So yeah, it was probably about 10-15 minutes into the video. Georgie says, I just jumped in late. Is Ed2Go weak? I've heard all kinds of stuff about Ed2Go. I've heard Ed2Go's kind of, and then I've heard people who have done it and had absolutely no problem. I think you're going to hear that for most programs that train medical billing and coding. It's also tough. I hear people say like, oh, I heard people on Reddit complain about this. Well, I think any program that you research online, you're going to find Reddit complain about. The Better Business Bureau is another one that I hear people say. They're like, oh, this program, I heard they have all these bad BBB reviews. And it's like, okay, well, if you go and review, like, if you go on sometimes on the Better Business Bureau or look at reviews for like Stanford and Yale and Harvard, you'll find a lot of bad reviews because that's just the nature of being online. People like to go and complain about things. People like to do that more than they like to go and give raving wonderful reviews. So most programs online, you're not going to find a perfect program. There is no program out there in medical billing and coding that's going to have 98% plus positive reviews unless they are deleting all of the negative reviews. So what we're really looking for when we look for medical billing and coding training is, are they going to cover something that's maybe going to help prepare you for a certification like the CPC? Is it going to have that 80 contact hours that can help you remove your apprenticeship status faster? What's included? Like maybe it's a very cheap program, but then you also have to buy books and textbooks, or maybe they're not going to include your medical terminology and anatomy training and you have to pay separately for that. So there's a lot of different facets to look for, but really, really focus on, is it going to prepare me for a certification through AAPC or a HEMA? And then also things like, are they going to offer career support? Are they going to help you work on your resume? Are they going to help you with your interview skills? Or do they offer externships? But if you're looking at a very strict budget, sometimes Ed2Go or something like that might be all uh, you have the budget for. Preppy's pretty affordable though. It's like under 2 grand. And they have payment plans. Oh, and I can save you $100, which reminds me. Do I have that on the media thing that I flashed up? Yes. So if you pay in full at preppy.org and use the code Contempo, you can save $100 if you pay in full. That is also available. All right. It is 1:00. I want to bring up this comment because I think it helps out the viewer that just came on TikTok. And Amer Hearts says, I completed Ed2Go with a 97%. It was not very helpful as it has like 0 coding videos. My instructor actually said, well, I can look up videos on YouTube. So there's one person's opinion on the Ed2Go program. In any case, I am heading out. I will be back next week at 12:00 Eastern time on Monday, if not sooner. We'll see. I've had some people saying that they wish I would do something on evenings and weekends. So let me know in the comments if you would like to see an evening or weekend live stream, or if you're catching this on the replay because you can't catch it on a weekend or an evening. Definitely let me know in the comments. I will see you guys next week. And until then, just keep on coding on.